Thanks for downloading today's Trinity Mother Frances Hospitals and Clinics podcast. Our guest today is Dr. Ming Liu, who is a retina specialist with Trinity Clinic Eye Center. Hi, Dr. Liu. Thanks for being here.
Thank you.
There are only about 2,000 retina specialists in the United States. You're one of a select few. Tell us about your specialty. What is it exactly?
I'm a retina specialist specialized in treating diabetic retinopathy, macular degeneration, uveitis, inflammation in the eye, and retina detachment.
All of these things have to do with problems with the eye. So let's kind of take them briefly one by one. Retinopathy, what is that?
People with diabetes, the blood sugar can damage the blood vessels in the eye and causing bleeding, scar tissue formation, and even detached retina. Without good blood sugar control, regular follow-up and treatment, patients can lose vision and even go blind.
You mentioned 2 or 3 others. Let's talk about those specifically. Are ultimately the results the same for all of those? It's blindness?
Yes, patients with macular degeneration that affect mainly people above 55 years old, mainly in Caucasian population. There are 10 million Americans with macular degeneration. There are 2 types. One is the dry type and can cause gradual loss of vision. The other type, called wet macular degeneration, they can have bleeding, leaking fluid in the back of the eye, and it causes scar tissue formation and loss of vision quickly. And the other condition is inflammation of the eye called uveitis, and they can have inflammation behind the retina and cause damage to the retina and cause loss of vision. The retina is just like a film of the camera, and once it's damaged, the eye cannot see clearly. And the last condition I'm treating is detached retina. People after 50 years old can have flashings, lights, floaters, and sometimes tears on the retina. It's just like clothing with a tear, and the fluid can go behind the tear, causes a detachment of retina. Without prompt treatment, they can lose vision.
Diabetes, is it a guarantee that if you get diabetes, that you will lose some, if not all, of your vision, or are there ways to prevent vision loss in diabetics?
For patients with diabetes, make good blood sugar control and blood pressure control can decrease the chance of losing vision. Otherwise, if the blood sugar and the blood pressure are out of control, they will eventually develop some sort of retinopathy and loss of vision.
And what, other than blood pressure control, sugar control, are there genetic factors that might dictate that someone is going to have more of a problem with their diabetes?
Yes.
Or is it all lifestyle?
Lifestyle also affects, genetic component affects too. And some families, they're prone to have more retinopathy developed in patients with diabetes.
How do you know that you're more genetically prone to have a problem? Are there genetic screenings that can be done to tell you?
There are some screening, but mainly we ask family histories. For example, if father has eye conditions, family members with diabetes lost the vision from diabetes, then we treat more aggressively, follow more regularly.
In your opinion, can diabetes be prevented, or is it, if you're prone to get it, you're going to get it?
Some are not, for genetic component make them more susceptible to get diabetes, but others, certainly diet and lifestyle modification can decrease the chance of development of diabetes.
If someone already has diabetes and they can't reverse it, they have diabetes, what are your recommendations to them to stay as healthy as they possibly can?
They would regular follow-up with their family doctors, endocrinologist, and also active lifestyles, keep exercise, losing some weight, and keep blood pressure under control. Then those all can decrease the chance of diabetic complications.
If a patient has retinopathy or a detached retina, let's talk about some of the cutting-edge treatments that you can help them with.
The most common of loss of vision, probably in patients with diabetes, it probably is bleeding in the back of the eye. And in the past, when they have bleeding in 1 or 2 eyes, we have to wait for a while and for the body to try to clear them up. And if not, then we go to surgery to vacuum the blood. But right now, with the new advancement with laser and the injection of medication into the eye, we can avoid the surgery and still maintain good vision. We treat before the bleeding starts.
If someone presents in an advanced stage of eye problems, at what point is there no turning back?
When all of the blood vessels in the back of the retina damaged, then there's no return. Because if the blood flow stops in the retina, it's like film of the camera. Once the film is damaged, they cannot take good pictures.
Okay, and in summary, what are the symptoms of progressive eye problems? And then let's talk about the solutions.
If patients notice blurry vision, trouble reading, trouble driving, they should have a regular eye checkup with their optometrist, ophthalmologist, and get screened. And also have regular follow-up with diabetes endocrinologist, internist, to maintain their good sugar and the blood pressure control. And once they are found to have diabetic retinopathy, they should have a contact, follow the referrals for prompt treatment.
If someone is listening to this and they say, my eyesight's so far gone, there's no hope for me, what do you say to them?
There's always hope, because even for people lose vision completely, and now there's a retina implant, and for people seeing pitch black, they can still start to see light. Although experimental, there's always a hope.
Where do you see your field in, say, 10 or 15 years? What do you see as some of the possibilities of treatment?
So right now, some patients with bleeding in the back of the eye from diabetes, from macular degeneration, they require monthly injection of medications or even laser treatment for their eyes. And right now, scientific research, very promising for long-lasting medications. We inject one dose of medication, it lasts 6 months, a year, instead of monthly injections. And also for patients who lost their vision completely, and implant, the retina implant, and the bionic eyes are on the horizon.
So how far out do you think bionic eyes are? That's fascinating.
We can hardly predict, but exciting things can happen quickly in the field.
Well, Dr. Ming Lu, we'd like to thank you for being with us today.
Thank you.
Dr. Ming Lu is a retinal specialist, and he is with the Trinity Clinic Eye Center. And for more information, you can go to our website at tmfhc.org. And to look for other podcasts available on the same website at tmfhc.org, visit the website, and at the top of the page, click on Audio, Video, Virtual Tours. And thanks for downloading today's Trinity Mother Frances Hospitals and Clinics podcast.